Hello, welcome to Health Circumference. I am Amedion Joshua, and this is our third edition of Nurses Celebration Week on Health Circumference. I want to give a special shout out to our sponsors, NGO Nurses, and to say thank you to Health Circumference for having me here again to speak with you. Today, I will be taking you through birth control. It's quite a sensitive topic, so let's delve into it. So, what exactly is birth control? Birth control is just another word for family planning, fertility control, anti-conception, contraception. It is just a means where people use medications, devices, and natural means to prevent unintended pregnancies. Now, why is this necessary? Birth control is necessary to families because it helps them to determine the number of kids they want. And it also helps them to space the pregnancies. Birth control is essential for every individual that is sexually active, in the sense that it helps to delay pregnancies and to prevent pregnancy-related problems and also early pregnancy-related problems and complications. It also helps to stop the unsafe practices of abortion and to reduce the transmission level of HIV from mother to child. Now, the different methods of birth control, like I earlier mentioned, we have the natural method where people actually count or study their menstrual cycle. Also, another method that's done naturally has to do with checking of the cervical mucus every morning, and also checking your temperature. These might not be very reliable methods, but these are methods that people would rather use rather than using medications and devices. And for the medications, there are downsides to it. For example, having to take the morning pills. If you miss the morning pills within the 3-hour rule, you're reducing the chances of it working from 99% to 90% and even lesser. And then for the injections, where you have to constantly go back to the doctors to have it injected every 3 months if you miss it. So there are actually downsides to using contraceptives, but it's always the best option. Another method that people actually use is the intrauterine devices that stays in the same place for the next 5 years and even up to 10 years and 15 years that people have actually used. Now, there are different impeding factors that might lead to people not practicing birth control, like I earlier mentioned. It could be the effect of the side effect, or the tendencies of people actually having side effects from these medications. So it's always best that you speak to your healthcare provider, your physician, to actually determine and investigate, have a run through of investigations and decide on which birth control method is best for you. And also the very popular barrier method, which is having to use condoms, having to use diaphragms, cervical cups, and the rest of it all. Now, apart from the side effects, people also shy away from using birth control because of the cost of it, and also because of cultural, religious, gender-based beliefs, where people think that having male kids is quite important or more important than having female kids. And this leads to people continuously reproducing over the years without actually controlling it. Now, the issue of not controlling birth is the fact that you tend to have more kids than you should have, and you tend to have more kids than your financial strength, than your natural capabilities. And the problem is you let these kids go out there to become a nuisance to the society. I will take Nigeria for instance. So in Nigeria, it's noted that women that are sexually active and people that are actually married have a reduced rate of the use of contraceptive. It's also noted that Nigeria's high fertility rate has negatively impacted the country's GDP. It's also noted that in Nigeria, the level of which women have kids, the rate at which women have kids is 5.3 above, which is more than the 2.3 that is globally accepted. And if a household should reduce the number of kids by 1, Nigeria's GDP is going to rise by 13% over a 20-year period. Quite impressive if you ask me. So we can see the effects that birth control comes with. And also, not just on the country's GDP, your health, your family. A family that has lower income and has up to 10 kids, I mean, you're predisposing these kids to so many harms, because you're most likely not going to look after all of the kids. You're most not going to have the financial strength, the knowledge, the skills to instill morals into all of these kids. That is where birth control comes in. Now, our job as healthcare providers is to continually create self-awareness and health awareness around sensitive topics like this. And not just about creating awareness, but also working with NGOs. Governments should work with NGOs, NGOs should work with other NGOs to make sure that these contraceptives are actually free to these people. And apart from creating awareness and making sure that these contraceptives are free, I think it's also pertinent that government take this gospel to the rural areas, because that is where it really matters. Because the more you're educated, at some point you get to listen, reflect, sit back and decide on which works and how you can control birth. And also, you should also understand that birth control isn't just for the ladies. It has to do with two people, the man and the woman, coming together to actually decide on what they need to do. So if you are a lady thinking of birth control and you're married, it is essential and pertinent that you speak to your partner about it and that you involve your healthcare provider before going ahead to have any of this. And the last resort for most people after having kids, or people that do not actually want to have kids, is always going for hysterectomy and vasectomy, which is not done on your own judgment. You need to work alongside with a physician to be able to decide which works best for you. And the good thing about birth control is comfort, of which most of us actually look for comfort in everything that we do. So I do hope that today you've been able to learn one or two things to actually, bring your mind back, reflect on what works best for you, and if you want to go down this path. And please, if you have any questions, please pop them down into the chat box and we will definitely respond to it. So here's me wishing a happy Nurses Week to all of us nurses there, and I pray that our hard work and our smart work actually helps the world and continues to help us as well, and that our pay gets improved. So happy Nurses Week to us all as we keep on hoping for a better future. Bye.